So I'm Bethany Allen-Cramphorn and I am a practice nurse at Whitstable Medical Practice. I qualified in 2008 and then I worked as a nurse for 4 years in various roles, and then I wanted to go travelling, so I became cabin crew for Virgin Atlantic with the intention of just doing it for 6 months, but ended up staying for 8 years. Then the pandemic happened and there were a lot of redundancies. So I was placed in a holding pool, and I thought I would, because I'd always planned to go back into nursing, I thought I would do the return to practice course, dabble in it, and then maybe go back to Virgin, maybe stay nursing, but I'm enjoying it, so I've told Virgin that I'm not coming back. I think when I left nursing, someone mentioned it to me, that it was a possibility, and I kept thinking, oh, I will do it, but then never had enough time in between flights to be able to do it. So then when the redundancies happened, it gave me a bit of time off. And I think I literally just put into Google and it came up with various universities, and then obviously Canterbury Christchurch was just down the road. You do part lectures, part practical. When I did it, it was at the height of the pandemic, so it was all via Zoom. I think we went in to do stuff that was you couldn't do via Zoom, so basic life support and the real physical stuff, and then you do most of your stuff on a placement, so most of your hours would be on a placement. So you come in, I was coming in twice a week here, and that's why I ended up working here, and they just sort of break you in gently to get your skills back up, and then there's a set of criteria that you have to meet to prove that your skills are adequate for you to go back into nursing, but it is done quite gently. They sort of work you up gently. I think it was probably 1 lecture a week, and then there was a fair bit of coursework, so we had to do 4 case studies and then a final larger piece, picking out certain reflections basically on what you actually finding in practice, and then writing up what happened, how you could have improved it, what you've learned that you can take with you going forward. And then when you were actually in the practice setting, they would tick you off for various clinical skills. So you had the kind of academic side of it and the clinical skills. So the practice, I had 2 mentors, but I could also work with various people. So clinics that I found interesting, so I got to sit in on the warfarin clinic, and the more specialist stuff as well that you could sit in on, and then you would be in treatment room for the majority of it. So you would start off with either with your mentors or people that they'd specifically allocated you to. You'd watch what they were doing, gradually you'd have a go yourself, and then by the end of it you would run your own clinics so that you felt confident when you left that you could do it autonomously. So you get funding, which I believe is £500, that you can put towards books, or if you need a laptop or whatever that you need. And here in particular, they were very, very good with, they basically said, when can you work? Because my youngest was only 2 at the time. So they basically said, this is when we're here, this is who you can work with, let us know what works around you. So I was doing 1 day a week on different days for when I had childcare, so they couldn't have actually been more accommodating than here. They were brilliant. Before I left, I hadn't worked in general practice. I'd been a community nurse, so I'd liaised with GP surgeries. I decided I'd like to work in general practice, which is why I chose this as my placement. The NHS, I kind of knew what was going on because a lot of my friends were still nursing. But yeah, I was nervous when I started, and then even more nervous once I started, because I knew that I had a bit of a knowledge gap, but I didn't realise how much of a knowledge gap until I actually came back. But yeah, everyone was supportive, but yeah, I was really, really nervous. And I've been here nearly a year now, and I'm just now feeling like I know what I'm doing. Everyone's been lovely, everyone's very, very knowledgeable here. I feel like, yeah, finally, it's quite specialised, that's the thing. And you are on your own a lot of the time, which is what appealed to me. But yeah, it's just taken a while to get used to it again, but I'm definitely enjoying it now. So general practice, I think, is fantastic for people who've gone off and potentially had a career gap because they've had children. It works so well if you've got a young family. Obviously you don't work nights, you don't work weekends, you don't work bank holidays. It really fits in really, really well, and they're very flexible as well with their clinics for it to fit around a family. So anyone who's gone off for that reason. We also have a lot of nurses here who are semi-retired. So maybe if someone's retired but thinking they'd like to come back but not do a 40-hour week, You know, it works really, really well for that, and it also works very well for people that want to specialise, because you can do what I'm doing at the moment is just the kind of bog standard treatment room, which is lots of different things, but nothing too specialist. But you can specialise in diabetes or respiratory care. You can specialise in family planning or the wolf room clinic. There's lots of things to get. You can't get bored basically. So for me, it's, if you don't want to work on a ward and have unsociable hours, it's perfect.